Today's question that we're going to look into deeper is, are there any risks or complications associated with breast explant surgery? So breast explant surgery is performed for a variety of reasons. Most commonly in my practice for breast implant illness. It can be obviously performed for somebody who's tired of having their reconstruction, just wants it taken down, wants to go back to a natural result, or a breast cancer patient who's flat. I've had a experience in all of those, relatively large experience, obviously, in breast implant illness. Risk and complications associated with explants are basically the same with implants, with a couple caveats. There is an incidence of entering the chest cavity, which is called a pneumothorax. In augmentations, it's low. Personally, I've done over almost 1,200 explants at this point, and that instance where you get a pneumothorax has happened to me in 5 cases in almost 1,200 explants. So super low incidence. And I haven't had a hematoma, which is the next thing that I would actually be more concerned about, which is bleeding. And I haven't had one of those in several years actually. So all those things should be low. And a skin infection, super low. I don't drain people anymore. I haven't had an infection due to drains in over a couple of years, obviously. And I've had one person get an infection when I haven't used drain in an explant only case, and had one other infection. So that's super low as well, given how many I do and how high volume practice I have. So it's always bleeding, infection, scarring. All right. So, scarring going to happen because you're reopening an old scar, or you're revising a lift scar, or you're making a lift scar.